Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Ortho Dermatologics.
New guidelines of care for psoriasis, a consensus statement on superficial radiation therapy, and promising data on a topical to support removal of light hair with lasers. Ahead on DermWire TV. Welcome to DermWire TV from the editors of DermWire.com and Practical Dermatology magazine. I'm Rana Jaraha. Two new guidelines from the American Academy of Dermatology and the National Psoriasis Foundation outline best practices for treating psoriasis with a focus on comorbidities and biologic treatment. An expert work group composed of several dermatologists, a cardiologist, a rheumatologist, and patient representatives developed the guidelines, which appear in the Journal of the American Academy of Dermatology. The guidelines are the first two in a series of 6 to be published. Among the comorbidities addressed in the guidelines are psoriatic arthritis, cardiovascular disease, metabolic syndrome, and inflammatory bowel disease. This guideline also addresses the increased risk of anxiety and depression in psoriasis patients, as well as the effects of smoking and alcohol consumption. The second guideline addresses the use of biologics to manage psoriasis. Dermatologist Dr. Alan Mentor, co-chair of the guidelines work group, notes that it is essential that patients understand the potential positive and negative effects of biologic treatments. This guideline provides physicians with the information they need to discuss biologic medications with their patients and help them choose the treatment plan that's best for them, he says. Practical Dermatology's chief medical editor, Dr. Neil Bhatia, addressed the significance of the guidelines for clinical patient care.
This really gives us a good overview of some of the meta-analyses and some of the retrospective studies that show the impact of psoriasis on a lot of the systemic conditions we don't take into account in dermatology. A lot of thinking about metabolic syndrome, hypertension, diabetes. I think this is information we could really use to educate the patients on the need for aggressive treatment and control of psoriasis for the big picture, justifying biologic therapy, for example, even more so is to convince patients that they really need a long-term strategy for their overall health and not just what they see outside.
Upcoming guidelines will address phototherapy, the treatment of pediatric patients, non-biologic systemic medications, and topical therapy for psoriasis. On the heels of a new retrospective study showing a cure rate above 97% among older patients treated with superficial radiation therapy, or SRT, for non-melanoma skin cancers in the lower extremities, new consensus guidelines suggest that the treatment should be first-line therapy for appropriate non-melanoma skin cancers in certain patients. The retrospective study that appears in the February issue of the Journal of Drugs and Dermatology included patients with a mean age of 82.5 years treated for BCC or SCC. New consensus guidelines published in the Journal of Clinical and Aesthetic Dermatology note that SRT is an appropriate option for management of primary BCC and SCC, significant SCC in situ, and certain cases of cutaneous lymphomas and Kaposi sarcoma. Guidelines also address suitable anatomical areas, energy fractions and scheduling recommendations for SRT, safety factors, as well as treatment recommendations for keloid scars based on the literature and on both the opinions of the expert group and a survey of experienced users. Dermatologist Dr. Mark Nestor, lead author of the guidelines, says they fill an important knowledge gap regarding the use of SRT. A new topical formulation from Sienna Biopharmaceuticals may make laser hair removal more effective for light hair colors. Top-line results from the pivotal trial of SNA-001 show statistically superior results for the topical agent in conjunction with an 810 nanometer diode laser compared to vehicle plus laser. The study involved 65 male and female patients with white, gray, blonde, light red, and light brown hair. Use of SNA-001 was associated with up to a 31% reduction of light hair from baseline. SNA-001 met the primary endpoint of non-inferiority in hair reduction. SNA-001 was also evaluated in conjunction with a 1064 nanometer ND YAG and 755 nanometer Alexandrite laser for the reduction of light hair. Despite significant reductions from baseline, results were less differentiated from the vehicle plus laser group compared to the diode laser study results. According to market data cited by Sienna, a safe and effective treatment for people with light hair could increase the number of laser hair removal procedures by 27% in the U.S. The dermatology drugs market is expected to reach $34.5 billion by 2023, a new report suggests. Research and Markets says that among topical corticosteroids, retinoids, biologics, calcineurin inhibitors, antihistamines, hormonal therapy, and others, biologics are expected to be the fastest growing category. Psoriasis drugs generated revenue of $14.2 billion in the market in 2017. That's it for this edition of DermWire TV. You can always get news updates at DermWire.com or via your Echo device. Just visit the Amazon Skills Store and enable the Dermatology News skill. Then tell Alexa to play Dermatology News. We'll donate $1 to Camp Discovery, up to $1,500 for every activation through March 3rd. Thank you for watching.
Thank you for listening to DermWire News. This editorially independent program is made possible with advertising from Ortho Dermatologics.